Welcome back, and let's take you right here now. In a significant move, Cabinet gave the go-ahead for the new Tobacco Products and Electronic Delivery Systems Control Bill to be submitted to Parliament. The bill seeks to change where people can smoke and how cigarettes are packaged. If it becomes law, indoor smoking, even in your home or in the car in the presence of a child or a non-smoker, will be illegal. Now let's discuss this further. We're now joined by Dr. Sharon Nyatsanza, Deputy Director of the National Council Against Smoking. Dr. Nyatsanza, thank you so much for your time this afternoon. Talk to us about the significance of this bill should it be passed into law.
So yes, the bill really is significant because when it's passed, we will see that people's public health rights will be protected. So we're looking at preventing the youth from starting to smoke. We're looking at protecting non-smokers more, and we're also looking at reducing smoking rates. So overall, we'll see a reduction in smoking rates, and that equals better public health, and that also benefits the economy of South Africa.
Now, a lot of people, particularly the non-smokers, and we'll address those that do smoke a little bit later on, but just on the part of the non-smokers, how will we see these significant changes that you speak of should this law be enforced? Because at the same time, we know that not too long ago, a law was passed saying that parents of children that are younger than 12 should not be smoking in front of them or should not be smoking with them in the car. But this has not been, implemented at all. You don't see it at least being enforced. Will we see significant change, especially in the part of those that do not smoke and would want to, not be affected by those that do, next to them?
Well, definitely. In terms of the previous laws, what we've seen in terms of smoke-free laws is that they actually are mostly self-enforcing. So in restaurants, you see that less and less people smoke in the indoor areas, for example, of restaurants. And the current law, for example, would have, let's say, a smoking room or a closed-off section for people who smoke. But what scientists have found is that they still see high amount of secondhand smoke, even in the non-smoking sections. So even closing off and all the ventilation and all the science is failing to actually, protect non-smokers who are sitting in the non-smoking sections. So we also have been talking about private dwellings, we're talking about motor vehicles. And this law is very important as well because it empowers the non-smoker. At the National Council Against Smoking, we get a lot of complaints from people who stay in apartments, in multi-unit residences, and they're complaining that, for example, let's say my child has heart disease, but my neighbor, is smoking in a space which is a common area, or he's smoking in such a way that it's become unbearable, or I can't live in this apartment. And whenever they would complain to us, definitely, yes, they do have the constitution, but we all know that it's really expensive to take on someone privately and then on the basis of the constitution. So they didn't really have a leg to stand on. So what this bill actually does is this: it gives them a leg to stand on. It actually empowers them, because previously everyone's answer would be the law does not regulate smoking in people's homes or private dwellings, but we see that this bill actually does change it. And it is really self-enforcing because we get all these complaints from people who stay in private places. It's not always complaints from restaurants, also places, in terms of private dwellings. So it is self-enforcing. If you just think of it, that people used to smoke in aeroplanes not so long ago, but now when you go to airports, they're smoke-free. When you get into an aeroplane, no one is smoking. So all these laws actually are self-enforcing, and they're actually also contributing to changing the societal attitudes around smoking.
Now, one of the important factors here, particularly for those that do have teenage children, is just the prevalence of young children, starting to smoke at very young age. How prevalent is it in South Africa?
So in South Africa, what we see is that the average initiation age is 17.6. About 74% of South Africans start smoking as children. And we actually have high prevalence of kids smoking. So it really is a problem. And I think adding to that is that we actually have a youth bulge in South Africa and in Africa as a whole. We're seeing that our population is now made more actually of the youth. And this is very important. So any public health strategy has to actually focus on preventing the kids from starting, because that is where the problem is. If 7 out of 10 people are starting to smoke as teenagers and as children, then that is really where the focus should be. And I think this bill does this very well, because it's not only a matter of saying don't sell to kids. It's a matter of creating an environment that prevents the kids from starting to smoke, including, for example, the image that we have on the screen, pictorial warnings. It's educational, including saying don't smoke in homes, because when you do that, you are making it more acceptable for the kids to start. So all the comprehensive measures actually in the bill, they don't work in isolation, but they work all in one direction to ensure that we try to prevent as much kids from starting to smoke.
And very quickly, just about, e-cigarettes and the safety around that. Of course, we know that this bill also targets them, but we're seeing younger and younger children, even those in primary school, smoking e-cigarettes, which are presumably so, safer. They have different flavors, in fact. What about this? How can parents then start weaning their children off these? Because we also understand there are now health implications. It probably is going to be a harder thing to do for parents, particularly as you see these hubbly-bubblies being smoked, even in house parties, and a lot of them saying that they actually contain no tobacco.
So, for example, we do have hubbly-bubblies, and these actually are tobacco. And people who use them actually might be exposing themselves to higher risks than those who actually smoke cigarettes, because they use charcoal to actually burn the tobacco. So, for example, the carbon monoxide levels are much, much higher. And you're talking about using hubbly-bubblies at parties. So all these things are actually contributing to how we see hubbly-bubblies. We see them as more normal, more kids actually will start using them. In terms of e-cigarettes are harmful, and there are a lot of knowns and a lot of unknowns around them. But one thing is certain, that they actually must be regulated. So we're talking about how they are being marketed. We're talking about where they're being sold. We see a lot of malls with kiosks that look fancy. We see a lot of flavors that actually are appealing to children. And that is where the problem is, and that's where the bill comes in to try and stop this. Because when kids start using e-cigarettes, they are more likely to go on to use the traditional kind of tobacco. And that in itself is a problem. So the bill won't ban e-cigarettes. The adults can still use them, they can still access them. But what we're trying to do is balance the interests here and ensure that less and less children actually start using e-cigarettes. So I think that is really what the bill is trying to do. And I think no one can dispute that it is important to try and stop the younger generation. Otherwise, if we don't, we're actually creating a new generation of addicts, and we're not really solving the problem.
Absolutely. Doctor, thank you so much for your time this afternoon. Really do appreciate it. Dr. Sharon Nyatsanza, of course, she's from the National Council Against Smoking. She's the Deputy Director there.